Communal wardrobe for mental health patients has opened on the New South Wales South Coast. It's the initiative of the former mental health nurse Keith Donnelly, who noticed patients were lacking the basic necessities they needed when they arrived at hospital. Keith Donnelly is with me in the studio. Keith, very good to have you along this morning. Tell me, when you started your first charitable walk-in closet, what problem were you trying to fix?
I was trying to fix a very obvious problem, like that many of our patients used to come into hospital with just the clothes on their back. A hospital stay might be anything from a week to 18 months and above. So during that time, the only suitable wear like that people would have might be a hospital white gown.
A hospital admission is usually kind of a planned event. How is it that people walk into a mental health facility and don't have that infrastructure or a family around them?
Funny enough, it's often very much unplanned event, admission into a mental health setting. The units that I've been working in for a number of years, we have our patients come in often involuntary, so they're held against their own will under the Mental Health Act at that time. And that's to just really assess their mental health initially, and also to apply and give whatever treatment is necessary, so they don't have time to pack a bag.
So you provide not only clothes but toiletries, shoes, accessories as well, and you allow people to pick these items for themselves. Tell me about the decision to do that, because that's a really interesting thing in terms of offering dignity to someone who is perhaps being held against their will.
Absolutely. Look, we're all about choice. We all love choice. For someone going into a mental health setting, it was often a way that we'd be rooting around as nurses to try and find some item of clothing, some tracksuit pants, some t-shirt. So this was ongoing. This was an issue back in Ireland as well. So when I came to Australia in 2016, I was quite surprised that this was much an issue here. We went on a mission just to set up this beautiful room that would be like a one-on-one shopping experience for people to go in and choose whatever their fashion is, whatever their size. I don't want to choose anybody else's clothing, nor do I want them to choose mine. So that's the area of focus that we really had. And during the visit, it's a time to just engage with that person as a human being, see how they're going, see what hobbies they enjoy. So everything mental illness, the reason they're in there stops at the door, and you just engage in this amazing experience.
What have you learned about people in that moment of crisis when you see them, you know, receiving this care and these options and this act of dignity? What does it do for them mentally?
It's so uplifting. The very, very first time I offered a guy in Ireland a fresh set of outfit that I had at home. I had some clothes I'd never worn, some are brand new, some not so new, but as good as new. It was just instant. The change in his self-esteem, his dignity, his confidence was very, very obvious, and he'd smiled for the first time in quite some time. He told me that he didn't have a change of clothes for so long. He didn't have family anymore. He didn't have friends, because that's what it leads to. Severe mental illness leads to isolation and loneliness in many cases.
And does that have a long-term impact then, once they sort of get a fresh set of clothes, they smile in their face and they can engage with someone like you? What long-term effect does that have?
Long-term effect is questionable, because like us, we get a new outfit, we get some new clothes. It's great for the first few weeks to wear, then it's not so new anymore. But what we're trying to do with Keith's Closet is not only clothes anymore. We have our warehouse space down in Alexandria now, where we're inviting our clients down to actually volunteer to be part of our organisation and give them purpose, and really give the steering wheel over to them and say, let's go guys, what do we need to make you attend here every day, and workshops, and really give them that focus that will be long term, and give them the skills to live a life. Absolutely.
Yeah. I know you raided your own wardrobe to get this off the ground. It's not easy starting up a charitable startup, but you have got buy-in now from government, from business. Tell us about how you've got them on board.
Yeah, look, some email arrived in my inbox last year, and it was an invitation to a cabinet community meeting course, I didn't know much about it. I'm a mental health nurse. It's not really my area. So I went back to my board and said, look, guys, we have this invitation here that we can attend, and we've got to have access to all the ministers in New South Wales. What do we think? So the guys thought, this is a great opportunity, Keith. Let's talk to the mental health minister, Rose Jackson, who I'd met a couple of times already, who's an amazing lady. And we got the opportunity then to meet Minister Ryan Park, the health minister, for the very first time. And it was at that meeting, it felt like I knew Ryan already 20 years. He was so engaged, he was so excited with the whole concept that we were bringing this into hospitals. And at that point he said, look, Keith, I want to know like what I can do for you. And so we went back to the table, we worked out like a bit of a plan, we returned to Ryan, and Ryan did what he said he'd do, and he supported us with a grant of $185,000.
And you've got business donating as well?
We have indeed. So we've got some clothing companies. We're building up our partnerships now. So Le Rap is one, and Swiss Re are two of our biggest partnerships at the moment, with lots of organisations locally in Randwick and the city. So this is something that we really, really want to build on as well.
What do you get out of doing this?
Satisfaction. I haven't stopped smiling since 2019. I just see the reaction and the difference that it's not only me, I might add too. We've got an amazing operations manager now, Grace Wilson. We have our board, we have our volunteers who are absolutely worth their weight in gold. For me, it's just great to see changing lives, and we haven't even started yet.
Keith, a very quick question around the state of mental health care in Australia right now. We know there's a huge demand, services are under strain. What's your view from the inside?
It is. Look, it's a very tough job. It's not for the faint-hearted, but I have to say we're trying our best. We're all trying our best. It's such a complex area. It's such a multifaceted area, like for people's mental illness, that you're just not treating a mental illness, you're treating about 9 or 10 different areas all at the same time, and it's just hard to get in on top of one thing to make a difference. So it's work in progress and always will be, but we're always achieving for the very, very best.
Keith Donnelly, you're quite the entrepreneur. Congratulations and thanks for coming in.
Thank you very much.